Omaha's news leader, chronicling the stories and people making a difference in our community. This is KETV News Watch 7's Chronicle.
And welcome to KETV News Watch 7's Chronicle. This morning, supporting the front lines in the pandemic. Hospital systems in the state have felt the weight of COVID-19 for 2 years now. From diminishing capacity levels to staff burnout and more. This morning, we're hearing from the leaders of 2 health systems in the state to get the state of hospital care and what they need from the community as we keep living with this virus. Well, the workload got so high, one of the Metro's largest hospital systems made a decision to officially go into crisis mode. Nebraska Medicine rolled out its crisis standards of care last month. Goal was to help guide doctors' decisions when the demand for resources exceeds availability. KETV News Watch 7's Alex McClune talked with Nebraska Medicine's chief operating officer just over a week later, who said the plan was working.
Friday marks 9 days of crisis standards at Nebraska Medicine. The chief medical officer urges you to get vaccinated against COVID because it could prevent them from denying more care to patients.
I think it's like anything else. Until you experience something firsthand, you never have the full grasp of the impact of the situation you're dealing with.
Dr. Harris Frankel says the hospital reduced outpatient surgeries and procedures by 50% since January 13th. He says the health system anticipated crisis standards when Omicron started to surge last month.
It had a significant impact on the absenteeism of our workforce. We saw as much of a 10-fold increase in absenteeism.
The hospital system contracted a number of full-time employees last month, and operational teams redesigned staffing plans to meet patient needs. It's nothing compared to what hospitals first faced at the start of the pandemic, and Dr. Frankel hopes it doesn't reach that point.
From an operational perspective, what we've done with staff will keep us from getting further into the continuum of crisis.
They're trying to stay positive, even though Friday marked the 4th highest day for COVID hospitalizations in the Metro's Hospital Coalition. Alex McClune, KETV News Watch 7.
Again, that report filed earlier, shortly after Nebraska Medicine issued its crisis standard of care decision. Nebraska Governor Peter Ricketts announced a directed health measure. It does not allow hospitals that are under those guidelines to perform surgeries unless it is an emergency. Nebraska Medicine is the only hospital that currently applies to. The system was already limiting inpatient elective surgeries since August. So, how are other health systems weathering the ongoing pandemic? Joining me now is E.J. Kuiper. He's the new CEO of CHI Health. Thanks so much for being here today. First off, you grew up in the Netherlands. You played soccer. How'd you get here?
I did, yeah. Playing soccer like a lot of kids do in the Netherlands. Did that throughout my childhood. Then was 19 years old. I had a pretty devastating knee injury, tore a bunch of ligaments, 2 years of surgeries and rehab. It was pretty clear I wasn't going to be playing competitively, but those therapists and athletic trainers were there for me physically, spiritually, emotionally, and I thought, that's what I want to do, and I became a physical therapist.
Nice. So you're now the CEO. Every leader has a plan. What's your plan? What's your goal, your vision for CHI?
It really is to take care of our employees and our medical staff, our physicians. I firmly believe that if you create a great place to work and a great place to practice medicine, then those great individuals can take care of the community of the patients that we serve.
Now we've had the original, talking the pandemic, we had the original COVID-19, we've had the Delta, we've had Omicron variants, now we have BA2, the so-called stealth variant. What's the situation at CHI?
Yeah, pretty soon we're going to run out of Greek alphabet letters, as you know. Here's what we know, is that we do appear to be on the tail end of this surge. As a matter of fact, we might be a little bit past it. And we see that actually in hospitalizations. Our EDs are a little bit slower. Now, we're not out of the woods yet, but I do believe that the models show that we will be in a much better place a week from now, 2 weeks from now. We still have to be careful, but things appear to be improving.
You know, Iowa's governor recently said that February 15th would be the final day of that state's public health emergency, saying it's no longer necessary because it can handle coronavirus like the flu and other infectious diseases. Do you think we're to that point yet?
You know, you can't really pick an arbitrary date, but we do believe that we're going to have to start thinking about this as a new norm. There will likely be another surge, maybe this fall, we don't know. The models vary a little bit in that regard. But what we do need to do is make sure that we have access for all patients and not just focus on the COVID units, the ICU units. So we also have to be there on the ambulatory side because other diseases like cardiac, oncology still evolve, and we want to make sure screening procedures are done so we can take care of patients on the front end of that disease.
Now, talking about that, what is your metric for judging how the pandemic is going? I mean, do you look at hospital capacity? Do you look at cases, new cases, ventilator use? What?
You know, all those metrics are important. Some are leading indicators and some are lagging indicators. So what we're seeing now is hospitalizations going down. That's a lagging indicator. So that's a good sign. And ultimately, that's where resources come into play. So the more hospitalizations we have, the more patients we have waiting in the ED, the more nurses, respiratory therapists, and doctors we need.
When do you think we'll get out of the pandemic and move into the endemic stage?
You know, that's a really good question. And I'm not going to guess, because there are much smarter people than me that can speak to that. But I do believe that once this surge is behind us, let's say in the next several weeks, that we will start going into a new norm. And I do believe that we have to prepare for the next event, whether it's another surge, it could be another healthcare scare. And that's why we have to take care of a workforce to make sure that we're prepared to handle whatever comes our way.
Right, and along those lines, you were quoted as saying, "We are all in this together. Genuine and sometimes random gestures of kindness and love can make such a difference in someone's day." And you talk about human kindness, such a stressful time for everyone. How is your team doing?
You know, they're hanging in there. I am so impressed with their resilience. You have to remember, this is now 23 months into this pandemic. All of us can rally for a few weeks, maybe a few months. Back when I was running hospitals in Florida, we had to prepare for a hurricane, but they came and went in a matter of days. Here we are going into our third year, and that's why we have to take care of one another. And acts of kindness, random or intentional, are so important.
You also said working on workforce wellness will be your focus going forward. You mentioned that just a couple minutes ago. How are you going to do that?
To be very intentional about the work environment. If I'm going to ask my wonderful staff to keep coming back, even though they're tired and worn out, and a lot of healthcare workers, as you know, Rob, are, I have to create an environment that they want to come back into so they can make a meaningful difference. So I'm going to be very intentional about focusing on wellness, because if we don't take care of ourselves, how are we going to take care of the community?
How can that, what would that look like? I mean, would it be just like little attaboy, attagirl kind of things during the day, or what?
You know, those things are not unimportant, but it's also about bringing additional resources into the workforce. Create pipelines, new housekeepers, new food and nutrition workers, new nurses, new techs, new therapists. So we need to really work today on what the challenges of tomorrow will be.
How do you attract, EJ, people to even get in the health field now? I mean, they see things on the news about how stressful it is. How do you even entice someone to say, hey, not necessarily for right now, but 5 years, 10 years from now?
Yeah, I would argue that now is a better time than ever to join healthcare. If you want to make a meaningful difference in people's lives, what better place than to be in healthcare and join the CHI Health team? And we have plenty of opportunities, not just from a professional perspective, but also to take care of people. And that's wonderful work.
What do you think the long-term impact on healthcare will be, the business of healthcare? I mean, the whole thing is changing.
It is changing. When you think about the changes over the last couple of years, really it's around virtual healthcare, telehealth, and a lot of those things are evolving, and we're learning a lot along the way. What's not changed, though, is that we are still making a difference in the community. And really, the community looks to us, healthcare in general, all the health systems here in the region, to be there during really difficult times. So that has not changed, and it will not change.
And is there anything the community can do to help you?
Absolutely. You know, still listen to the guidelines. Be careful. Even though we are optimistic and hopeful, and we think the models show us that we're going to be in a much better place, we still have to be careful. Mask up, get your vaccine, social distancing, and then we'll be all much better off in the spring.
When you came here from a hospital system in Illinois, was there anything that they're doing that Omaha should be doing, or anything that you think that we should be doing in general?
You know, one thing I did in Illinois is develop an internal staffing agency. And so that agency helped us allocate staff to where the greatest needs are, because geographically sometimes the needs are on the western side of the state, on the northern side of the state. So having that pool of extra resources helped us tremendously, and we're going to do that here in Omaha and beyond as well.
Do you have a timeline set to get that done?
We're working on it right now, and I want to have something in place by spring, summer.
Well, E.J. Kuiper, thanks very much for joining us today. Best of luck. Welcome to Omaha, and I hope everything turns out well for you.
Thank you.
All right. Well, still ahead, the impact of the pandemic on rural hospitals and how another health system is trying to make the best of the situation. You're watching KETV News Watch 7's Chronicle.